Hello, welcome to my Pecha Kucha presentation case study for patient with chronic pain. Today we'll be including a history, physical exam, image review, differential diagnosis, and a potential treatment options. Our patient today is Paul. He's a 64-year-old Marine veteran. He comes to us today with a long history of chronic neck, back, and knee pain. And he shows up today mainly because he wants relief from pain so he can sleep better and also take care of himself also better and lift objects. Upon reviewing Paul's history, a few red flags do appear, most notably that for depression, some anxiety, a history of alcoholism. He did have a suicide attempt back in 2008. And in several instances, he kind of reports isolation and not much socialization. A few things of note causing Paul's pain is a history of neck surgery. He did have a neck fracture about 15 years ago, also some knee surgery, and also bilateral knee osteoarthritis, which he also complains, besides his neck, also of knee pain. A few things that have helped Paul in the past to alleviate his pain is he has seen a chiropractor. Stretching seems to help. Whirlpool and also cool ice at times. He has tried a TENS unit. And he uses a crazy cane for his knots that he says are on his neck and back. Activities that makes Paul's condition worse are activities that he maintains for prolonged time, such as sitting or driving, and he seems to feel better once he gets up and moving, stretches, or when he just rests or lies down, as well as the things mentioned previously, like the TENS and chiropractic. So when we meet Paul for the first time to do a general exam, he appears to be a very healthy, pleasant, elderly gentleman. He moves around well, has normal strength. Really, the only thing of significance is he tends to position himself with a head forward position. And when we review the medications that he's taking, just three he's on, the gabapentin, which doesn't seem to be helping him very much. He also says he takes some naproxen, mostly for his knees, which he says does help some. His right knee still is hurting quite a bit, and he has been on methadone for quite a while without much help. When we review Paul's MRI of his cervical spine, it's apparent that he has severe degenerative disc disease in his neck and spondylosis. He has several areas of osteophyte formation, compression on his thecal sac, including some areas of spinal cord compression. When we attempt to do some range of motion exercises with Paul's, it's apparent he has very limited range of motion in several directions. Lateral, very diminished. He is able to flex forward, but his extension backwards is very limited. And then just of note, any provocative tests were negative for Paul. When we start to palpate areas of complaints Paul is having, it's apparent he has multiple trigger points in several muscle groups in his neck, upper back, extending into his thorax, almost down into his lumbar area. He has some new areas in his front, in the pecs, and also in his periscapular area. When we move on to check Paul's sensory and reflexes, everything for the most part is intact. He had a few minor changes. He had a right shoulder diminished touch, a little bit of a diminished left triceps reflex, and slightly bilateral abduction weakness on both hands. Some other information I think would be important to find out from Paul is what exactly was his neck surgery that he's had in the past. Is there any other images or tests available that he's had in the last few years? How's he doing with his depression and anxiety? He does have diagnosis. And what other injections has he had and how have they helped? My initial diagnosis would be that of myofascial pain syndrome with multiple trigger points in several related muscle groups in Paul's back and neck. They're classic for pain with palpitation. There's a referred pain with that, and also taut and contracted muscles that very much limit his range of motion. Some other things to consider would also be cervical facet syndrome. Definitely limited range of motion backwards. He did have a negative facet loading. Also, that of radicular pain. He is having some radicular symptoms bilaterally, and that because of his neck surgery and some other symptoms down his arms of myelopathy. On this visit, I would offer trigger point injections, but also very important would be physical therapy to continue to work on his trigger point areas for massage and stretching, and also look at his posture with his head forward. Also looking at insomnia, depression, his knee pain, some exercises, and looking a little bit better medication management. On further follow-up, we would look at the effectiveness of the trigger point injections and see how Paul's doing with that, with his physical therapy, the stretching, and the taut muscles. If he continues to have some radicular symptoms or pain just in his neck, also potentially some facet injections or epidural injections would not be contraindicated for Paul because of his surgical history. Paul presents many areas of potential pain generators causing his chronic pain. Because his pain is chronic in nature, coping, medication management, posture, and strengthening will be priorities for his improvement and long-term pain management goals. Furthermore, because his pain is chronic, including other pain management modalities may be very beneficial to Paul. The association of depression, anxiety, and insomnia with patients' perception of pain is well defined and needs to be better addressed before improvement may be seen. Paul appears to have realistic goals and has taken steps to improve his health. Through sobriety and recently stopping smoking, with a few minor interventions and some lifestyle changes, he may see some definite improvement.